Okay, I'm going to go over a few common digestive system disorders. All right, celiac disease. You do hear about this a lot. It used to be quite rare. Now, recent research suggests that perhaps it is more common. The question is it more common or is it more regularly diagnosed? And that is up for debate. But it's a real disease, and it's a disease that causes malabsorption. And it's an autoimmune disease with a genetic component to it, so it runs in families. And a person with celiac disease has a duodenal mucosa that is not proper form and is not as successful at absorbing nutrients, specifically gluten. So whenever somebody with celiac disease ingests gluten, the immune system will respond by thinking that that gluten is foreign, and it will then damage and attack the small intestine, which then leads to malabsorption, because if your mucosa of your small intestine isn't functional, you won't be able to absorb nutrients. So the treatment for celiac disease is to avoid gluten products. And gluten is in several grains, including wheat, would be the primary gluten source in the average American diet anyways. And symptoms of celiac disease are going to be gastric upset symptoms, so bloating, diarrhea, vomiting, and weight loss due to the malabsorption. There's a variety of risk groups, but certainly if you have a relative with the disease, you're more likely to get it because it is genetic. If you have other endocrine diseases, typically one endocrine disorder can make you more prone to others. And some examples of that would be somebody with type 1 or child onset diabetes or thyroid disease. Those are some endocrine disorders that are related to celiac disease. All right, IBS, or irritable bowel syndrome, is a disorder of the large intestine, and it can lead to opposing symptoms of either diarrhea and or constipation. Some people are plagued with both alternating. And it can also lead to general cramping and bloating. It's quite common in women more than men. It's often diagnosed by middle age. The exact cause is not known, but it could involve neural communication to the bowel. It can also involve sensitivity to pain, and it can also be related to a so-called sluggish bowel, which is movement in the GI tract that's too slow, or sometimes that's too fast. So when those mass movements are taking place at the wrong speed. All right, imagine you've heard of ulcers before, and we used to think that they were triggered directly by stress, but now we know that they're caused by the activity of a bacterium that lives in the pylorus of the stomach, which is where it got its name, Heliobacter pylori. And this bacterium disrupts the pH balance within the stomach, which leaves the lining of the stomach prone to damage from the acids, and the pain that results is called an ulcer. And a typical symptom would be pain between meals, and the pain stops after taking antacids because you're neutralizing the acids, and therefore you're no longer getting the burn on the wall of the stomach. So the risk group would be anybody who's infected with H. pylori, and children are at greater risk of contracting many pathogens, including this one. And the organism, you might get it as a child, but it can remain dormant in your body for many, many years, and then you might not even get symptoms until an adult. All right, hepatitis is a generic term for inflammation of the liver. It actually has a lot of different causes, including sexual transmission from viruses. It can also be contracted through food. It can also be related to drug and alcohol abuse. It can also be related to autoimmune conditions. So there's a lot of different types of hepatitis and a lot of different causes of hepatitis. And so I won't really get into risk groups because those are going to vary tremendously depending on the particular form of hepatitis and the particular cause. Symptoms would be vomiting and diarrhea and change in appetite. Remember, your liver does assist with digestion, so you're going to get changes in your GI tract as a result of hepatitis. You'll also get changes in the color of your urine and your bowel movements, because remember, one job of hepatitis is to process bile, which ultimately the color of bile comes from the processing of heme. And that also is related to jaundice. When you get yellow skin or yellow in your whites of your eyes, they're yellow instead of white. That's a buildup of products from the heme group being improperly processed because the liver is not functioning. And another symptom of hepatitis can be generalized abdominal or stomach pain. All right, so diverticulosis and diverticulitis are related conditions. Diverticulosis is when you have deep bulges or pouches extending away from the colon. And when it becomes diverticulitis is if one of those pouches perhaps gets inflamed or infected. If, say, a bit of feces gets wedged or lodged in there, you can get a little bacterial infection, and that can lead to inflammation. And at that point, you call it diverticulitis. So diverticulosis is often asymptomatic, and then when you get diverticulitis, you may or may not get symptoms. If you get symptoms, it'll be bloating, kind of a full feeling in the abdomen, cramps, and then sometimes constipation. If you have a severe form of diverticulitis, you can actually get bleeding in the stool and actual blockages or tears along the colon. Those at greater risk are the elderly and also anybody who lacks fiber in their diet. You want to be able to keep feces regularly moving through the colon to keep the colon healthy. All right, lactose intolerance, I'm sure you've heard about, and it's the inability to properly digest a sugar found in dairy products called lactose. And the enzyme that you use to digest lactose is called lactase. And some people lack the enzyme lactase or don't produce it in sufficient quantities. So this can be related to your actual genes and the inability to produce proper lactase for the digestion of lactose. So typically, symptoms will occur after eating a lactose product. So after eating dairy or something, you might get gas or diarrhea or bloating. In the U.S., it's more common in minority populations, especially those of African, Asian, Hispanic, or Native American descent. So it's fairly rare in Caucasians. It's more common in the elderly and in premature newborns. Because they might not have proper enzymes yet if they're born prematurely. And then other intestinal diseases, especially those of malabsorption, can be related to lactose intolerance. So like those with celiac disease are at greater risk of being lactose intolerant.